Hello and welcome to another 5-minute blog summary. Today's blog summary is on personalized medicine. This blog breaks down this evolving area of medicine called personalized or precision medicine. It's an exciting new kind of area and approach to care where we take data to help group people to create more individualized treatment. This area obviously involves everything from kind of cellular analysis, tissue biopsy, looking at cell markers, but even more so genetic testing. So in this blog, I kind of describe and explain a little bit of the history of genetics, how we came to understand what genes are and what influences them. And now we're in this really exciting time where we're understanding that it's not just I give you my gene and then you will have that gene expressed. That essentially the environment really plays a role, and there's all sorts of factors that determine a gene's behavior. So we call this area epigenetics, and it can kind of make things really exciting in understanding that it's not always that simple. So personalized medicine oncology is important because it can kind of help us have a little bit more insight into how to make the treatment a little bit more tailored to the individual. So we can see that basically because both nurture and nature matter, there are a lot of different ways that we can approach how treatment is designed. And we know that cancer essentially is probably a little bit of both in a delicate dance of nature and nurture. So using the nature piece, we can understand a little bit more of those non-modifiable risk factors, such as your acquired inheritance and your genome. So through some genetic testing, you can kind of understand a little bit more as to how you might react to certain medications, how you might metabolize them, and what dose might be appropriate for you. So this is how personalized medicine can use genetic testing to tailor individualized treatment approaches. Just to overview once again, obviously in cancer we have nature, nurture, and kind of a lot going on into why someone received a diagnosis. You can have a very fit and healthy individual who doesn't carry a gene acquire a cancer, and someone who does carry a gene and who isn't very active be cancer-free for their entire life. So it isn't always exactly straightforward, and that's where it's really important to understand that the environment of genetics expression and epigenetics is still an evolving field. So we have obviously in cancer non-modifiable risk factors such as family history and inherited genes, gender and age, tissue density and ethnicity. And we have modifiable risk factors like nutrition, exercise, alcohol, how much you smoke and hang out in the sun. And so we're coming to understand that modifiable risk factors is where we have some control and behaviors and how we choose to live, the choices we make. But non-modifiable risk factors, we actually have a little bit of exciting control there too through the world of personalized medicine. So I think it's really important, just on a kind of side note, that we start removing a little bit of the shame around a diagnosis. Often patients of mine will be like, what did I do wrong? And I think it's important to understand that because of epigenetics and what we understand in current gene transcription and so on, sometimes it's just in your genetic code and the gene expresses itself. And that's really unfortunate, but that is a reality. So I think it's important that we start to understand more about what we can learn from that and what we can do instead of carrying any shame or blame and pointing our fingers at others or making judgments. So this field of personalized oncology treatment is really exciting. It opens up a new window of understanding of some of those non-modifiable risk factors. It also helps remove the shame in understanding that sometimes genes do just express themselves. And it can help minimize risk in new ways as we understand more about the genes we carry and the impact that might have on others that we're related to and those we love. So it's an exciting area, and through genetic assessment and tissue biopsies, this is how you're seeing in the world of breast cancer. Treatments are more personalized to hormone sensitivities and HER2 expression and so on. You can see a lot of variation in different treatment plans depending on the data that was gathered. Another really exciting thing about personalized medicine is it will probably lead to just less symptom burden, less general systemic pushback. We see a lot of deconditioning and cancer-related, vestibular neuropathies or chemotherapy-induced vestibular neuropathies, chemotherapy-induced peripheral neuropathies, cancer-related fatigue, and these are kind of big systemic responses through these kind of general throw a ball at it approaches. Now through personalized medicine, we can see sometimes a little bit less symptom and setback because the medication acts a little bit more specifically and is more tailored to that individual. So this means potentially that rehab might be a little bit less complicated, which is exciting. To zoom out with personalized medicine, I like to kind of use the analogy that we can use that same approach in rehab. And at the Cancer Physio, it's in our tagline. We really prioritize a personalized medical approach. This means that your rehab is tailored to your diagnosis, to your cancer stage, grade, and type. It means that we place you into one of our 5 phases of rehab: prehab, treatment, recovery, return to work, or active living. This means that we also, progress your program according to your pace and your goals. And we meet you with the support level that you feel like you need. Maybe that's once a month, maybe that's once a week. It's all outlined on the website. Some people really don't need a personalized rehab approach. They have an active background, and they also find that they're not experiencing a lot of symptoms and setbacks. So more of those general online exercise groups work really well for them. But for some people, they need a little bit more one-on-one coaching. And that's where personalized medicine and rehab can be really powerful to optimize outcomes. So if you have any questions about genetic testing, some of the resources available in the States, because that's mostly where it's done, feel free to reach out. Feel free to share this blog with anyone who has some curiosities about personalized medicine. Once again, thank you for your interest in science and rehab.